All right, in this video, we're going to be pillowing a person in the prone position, and then we're going to be going through a series of drapes. I'm draping the back, both lower extremities in both a lower and high gluteal drape. So I'm just going to be starting by placing some pillows underneath the legs. I prefer to fold both parts of the sheets over, and then I'm going to reach underneath and lift up their legs so the sheets stay neat. I have some pillows close by, and now we're going to be kind of strategically placing these pillows so that they're actually supporting the ankle, which is the purpose of them. So a starting point is to slide them up towards the tibia, kind of where the knee, and then when we rest the legs, we're actually looking for is that these pillows are at a height that puts the Achilles tendons in like a softened position here. If you place your pillows too low, you're actually forcing the foot further into a plantar flex position, which is the exact opposite of what I'm trying to do with this pillow in the first place. So again, we'll lift these up, slide it up into the tibia, and then rest the foot. And you might need a variable height depending on the size of the person's foot in case you want to raise it up to give them more kind of range of motion, slack in their ankle complex. So I'm going to fold this back over, smooth out our sheets here, and now we're going to be going and placing some shoulder pillows. I'm just taking a quick kind of brief assessment, feeling across the shoulders, and I'm noticing they're kind of rounding forward a little bit. So I'd like to place shoulder pillows on either side. So I have a couple of those wrapped. I'm going to start by just folding my sheet up, reaching underneath, grabbing the bottom sheet, folding it across, asking permission to reach underneath and hold your shoulder up. So I'm going to lift this up and place a pillow underneath. So again, how you place your hand, because I am going in the proximity of breast tissue, I don't want to place the top of my hand and then go pushing into it. So I prefer to use the pillow and slide it in. And when we bring the bottom sheet down to help this pillow stay in place, it's actually easy just to tuck it underneath. So now that pillow is not going to slide out on us, and I can fold that over. And I'm just going to do the same thing on the opposite side here. Let's place that to the side. Again, we're going to fold back the sheet, ask permission to tuck and lift up your shoulder, like so. We're going to fold this pillow underneath, using the pillow towards the body. Take the bottom sheet, just tuck it underneath, holding that pillow in place. And then I can fold my sheet back over. And for the purpose of my leg drapes, I always like to have an additional fold at the top of the sheet here, just in case the sheet starts to slide down, I can fold this back up. So that seems to have brought our shoulders up a little bit higher, flattening out that anterior movement of the shoulder, a little bit of an anterior rolled movement or protraction. And I'm gonna ask, does that feel comfortable for yourself? Mm-hmm. Okay. So we have our individual now pillowed up in a prone position, and we are going to go into individual drapes. We are going to move into undraping the back. So the first thing that we're going to be doing is trying to kind of landmark and describe to our patient here approximately where I want to bring the drape down to. So I'm using the palms of my hand and feeling the posterior aspect of their low back and spine, and I'm looking for two bony projections on either side. These are known as the posterior superior iliac spine, and that's going to be a good draping boundary line. It's a little bit below what we call the iliac crest. So we're going to ask permission to bring the drape down to this location, if you're okay with that. Mm-hmm. And the next thing that we're going to look for or feel for, again, is going to be undergarment. So you're going to ask permission to tuck into undergarment, but not everybody is wearing an undergarment or make it easy to tuck in. So if we've asked permission, I'm going to kind of grab the top of the undergarment and create the initial fold so that I know as I bring my sheet down, which I'm going to do now, as I do this, a nice gentle fold back, it should bring it to my tuck-in line. So I'm going to then move on to either side, and we don't want to leave it open here. So I want to make sure it feels snug and secure. So I'm going to start on the side that I'm standing. I'm going to bring the arm slightly out, or I can even hang it gently off out of the way for a moment. And I'm going to grab the bottom sheet as I use the back of my hand and secure it underneath their hip area. And again, we're going to bring this arm back up, like so. Now I like to walk around to the other side instead of reaching across the client. I'm going to do the exact same thing. So I'm going to slide down alongside of their hip, and I'm going to grab the bottom sheet tight as I use the back of my hand to secure it underneath their hip. This is not my end draping. It is kind of stuck on both sides, but preferred for a back treatment. Again, our PSIS is here. So again, I'm just going to let the client know that I'm going to be tucking and bringing this down a little bit if they're okay with that. And I'm going to end up rolling this in, which actually tightens up my drape as I bring it across, like so. Now, some individuals will prefer to strengthen this drape even more. So if you want to, some people will bring a towel across this, but I actually find this is quite snug since it's rolled up on itself and it's secured on both sides. So unless your client is cold or you want an additional layer over top of their gluteals and legs, you can add a towel, but for the purposes right now, I'm not going to. So we're going to call this the undraped back, which we would then move into doing some treatment. A little additional piece that some clients appreciate is, since we're going to be using oil in our treatment, the hair can sometimes absorb some of that oil as we're doing a lot of our effleurage strokes up into this area. Nobody really likes an oily head. So what we're going to actually do is take a towel or a light sheet, and you're going to basically place it across the back of your client's head, tuck it in, and then I can pull some of the hair out of the way. So depending on how you prefer to do this. And now I'm able to go up and do an effleurage style motion or work on the posterior aspect of their neck without having their hair coming into the way, which means I'm not getting hair in between my hands as I'm working, and I'm not covering the back of their head with any oil. All right, this is a undraped back for us to do some treatment on. All right, as an addition to a back drape, we were looking to work on gluteals, and sometimes doing a really high leg drape is actually more challenging than it is to working on the upper gluteals like gluteus maximus and medius origins through a back drape. So I'm going to ask permission. I already have, but I'm going to ask permission again. Can I please lower the drape on the side? Mm-hmm. And what you're basically trying to do is expose one upper glute instead of obviously lowering the entire sheet. So what you can do is, again, we're going to untuck on the side here, and I'm going to roll it in and tuck it down, roll it in and tuck it down, just lowering it on one side. So this gives me, again, a drape that's secure on the other side. I'm going to tuck it back underneath the thigh. So this is still quite tight, and yet I have this much of gluteus medius and the beginning of glute max origin for myself to work on. So if you're wanting to use some of your techniques, again, standing from above, we could be doing strokes that we're going down along this glute. Change my position here. So again, examples of treating over top of our iliac crest being here. So I'm lower than the iliac crest and doing strokes out along these upper glute attachments. So you can get into the erectors, into multifidus and rotatories, down the lower aspect in here, as well as upper glutes and some of that thoracolumbar fascia for your abdominals and latissimus dorsi. So this is a really nice additional lowering of the drape to access more muscles. We're going to be doing a lower extremity drape. So we're going to be doing just a standard full leg drape up to the glute fold area. So I've already communicated that with my partner, but I'm going to give a tactile cue that I'm going to be bringing the drape up to around this location. And are you comfortable with that? Mm-hmm. Okay. So the first thing, we're going to go through a series of steps here, is we're going to take our top sheet and we're going to start to pull it together, kind of wrinkling, but I want to keep the edge close by, and I'm going to place that down in between the two legs. Now, if you need them to, you might ask for, or again, I'm just going to pick up your leg and slightly move it over to the side to give yourself a little bit of space for draping. But it's really key here to keep the edge close by and move the extra material towards the midline a little bit. The second kind of target I'm looking for is when I do this maneuver, I want to be approximately halfway in the thigh. If you leave this sheet too low, when you bring it to the middle and then go to pick it up, you're going to take too much material with yourself. So again, we bring the edge up, I fold it on the inside, I have the edge nice and easy accessible, And now there's going to be a couple steps here. So in this part, I'm going to grab the ankle, lift it up. With my inside closer to the body, I'm going to reach underneath, grabbing their knee, and I'm going to rest this leg on my forearm with the foot to the outside. Okay, so this gives me the ability to pick it up. If I have to, I can use two hands, but ultimately I'm going to have to let go with my outside hand while I'm able to stabilize this person's leg with my inside hand. I'm going to reach underneath the sheet, underneath their leg to grab the sheet, and I'm grabbing the edge. And once I've grabbed the edge, I'm going to start to slide that up towards their glutes, and in this case towards their hand. Once you've brought it up a good distance, and what I mean by a good distance, and I'm actually kind of going towards the top of the glutes here with where this sheet edge is, or towards their undergarment line, I'm going to then bring the leg back down and carefully fold it back so that the foot is on the table. As you can see, by the way that I did that, I still actually have a lot of sheet covering the other extremity without bringing too much material up. Now, this is not going to work perfectly with every single person, but again, you're going to have to try it several times, and the length of a leg or the amount of tissue that you're trying to kind of maneuver and drape around is going to change how much sheet you have to bring up. Okay, so I have brought in the bottom sheet up. Now I'm going to take the top sheet, and again, we talked about bringing this up to around here, which is what we're going to call the gluteal fold. So right where the hamstrings meet gluteus maximus. And I'm going to take some of the extra sheet, these folds, and I'm going to bring them up out of my way. As I do so, I slide this edge up higher, and now I'm going to tuck it in a couple times on itself, so I'm creating a roll. I'm going to repeat that step for you. So we brought in the sheet up, it looks something like so. I'm going to grab the edge, I'm going to pull some of my extra material up towards the midline, and slide my drape up to where the glutes meet the hamstrings. At this point, I have a nice tight edge. I'm going to bring this down. And now as you can see, I brought my bottom sheet to a very similar location, which is kind of useful so that we have a full ring of material going around the entire thigh. And I'm going to tuck this underneath our patient here. So again, we can snug this one up and tuck both of them underneath. I'd like to make this a little bit tighter, so I'm just going to roll it up on itself, tightening up the ring. Now we are going to strengthen this drape a little bit using a towel, because I'm going to be working around this proximal hamstring area, and I don't want this material to keep sliding up or down. So I have a towel with me. And with this towel, I'm going to be laying it across the body, like so. And I'm going to be keeping the top of this towel, the bottom of the towel for myself here, or the top kind of my drape. I'm going to snug it underneath the body again. And I want to fold the top of that edge in, securing the top of my drape and bringing it across the body. So therefore, if I do any amount of treatment in and around that hamstring edge to the bottom of glute, the towel is actually holding the material from sliding down. So that makes it nice and comfortable for me to do some work around here without knowing my sheet's going to slide down. The last part to this, if you notice that the inside of the drape here feels a little bit loose, you're never going to be tucking and folding on the inside of the thigh. So instead, the material that you brought through and under, what you're going to do is that you're going to snug and pull on that, which actually pulls the edge of this material right where my finger's pointing up. So I'll give you an example. Watch that sheet edge right there, and that snugs up and in there. So that will tighten up the ring. Now I have a full undraped lower extremity for me to do some work on, for example, like an effleurage strip. As an add while you're working on an individual's leg, if you're finding that the arm keeps on wanting to slip or fall off the edge of the table, an easy option to actually do is to take this bottom sheet, which we have here. I'm going to fold it over the hand, and I'm going to tuck it underneath the hand and the forearm. So this actually keeps your client's hand warm, plus it actually prevents it from falling off the edge of the table. So this is a nice little addition so that if you're needing to kind of work in the area and they feel like their hand's going to fall off the table, they don't know quite where to put it, now it's actually secured up against the end of the table and it won't move on you. All right, we're going to be doing a high leg drape this time. So if you've watched the previous video, we did a drape that brought just to kind of the bottom of the gluteals meeting the hamstrings. But the purpose of this drape is to get access skin to skin to the gluteals. So we've had a conversation with our client already, but again, I'm just going to order her and just give her an idea. We're going to be bringing the drape up to around this location and then down along here. And are you comfortable with that? Okay. So this is very similar, however, it's going to have a slight few different barriers and kind of landmarks as I do this leg drape. So if you've already watched the previous one, this first step is exactly the same. We want to bring our sheet towards the midline. I want to keep that edge close by. And again, I want to start around that halfway point when I start to lift this leg up. I'm going to grab the ankle. I'm going to reach underneath, grab the knee, lift up the leg, reach underneath, grab the edge of that sheet, and this time I'm going to be thinking about their shoulder. So I'm actually going to pull this to the side just so you guys have an idea, and just to get the hand out of the way, if you don't mind just having it kind of hanging there for a moment. So as I lift this up, to give you a visual, I'm going to be going up towards shoulder, 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 shoulder. So I've actually brought it up quite a bit higher, all the way up to their iliac crest this time. Instead of kind of stopping around this range, I'm actually bringing it up towards that undergarment line. I'm going to bring a sheet down. I'm going to fold this down. And now we're going to be bringing the drape up higher in the gluteal area. So again, I'm just letting you know, I'm going to be bringing the sheet up quite high, and it is going to kind of feel almost like a wedgie as in bringing it up in between your gluteals if you're so comfortable with that. Keeping this edge tight, I'm going to be folding material towards the center. And as I do so, when you see, I'm going to keep this really tight as I'm folding the material up towards the center line. But I constantly have tension on the sheet. So again, I'm going to bring it up nice and tight, and then I want to fold it in on itself a few times. And if they are wearing an undergarment, you can ask permission and then tuck into that as well to strengthen this drape. And then we bring it down on the side, and just like before, we're going to tuck that underneath their body. Okay, so this is a high leg drape with gluteals exposed for the purpose of treatment. I'm going to pull out the bottom one. Again, if I need to tighten up towards the groin area, right in this area, there's definitely no way I'm going to be kind of pushing or tightening up with my fingers. So instead, I'm going to grab that bottom part of the sheet and just cinch it up really tight, which strengthened that part of the drape up. Okay, just like before, I'm going to use a towel to reinforce this drape. So we've collected our towel from the corner. I'm going to lay it across the body, and I'm going to again put the bottom of this towel towards the top of the drape line. So I'm going to start by anchoring it on one side. I'm going to grab that bottom sheet and tuck it underneath their hip. So right in here. And then utilizing just the bottom of that towel, I'm going to tuck it in to the undergarment line and right at the top of that drape and bring it across the body. So this is going to hold this drape up from sliding down. Now, certain people will change kind of how they like to use the towel. Myself, I like to actually tuck it in underneath on the opposite side of the body. Can I have you just roll away gently on this side for me? Perfect. Like so. And so now I know that this towel isn't going anywhere. You can place it a little bit more on an angle if you'd wish to have it go in this direction. But again, this should feel pretty snug for the body. And I'm just going to say, are you comfortable with the drape that we've done so far? Okay. So again, if I have to readjust at any point, you're going to either tuck at the top here or pull from the bottom one. I'm going to point out one last thing, that if you have pulled too much sheet, and the opposite foot is exposed, something like that. A really, really easy cover is to take the bottom sheet from below and just fold it again and cover up the leg. So now I'm still only wanting to undrape the limb that I'm working on. And just like before, we can bring the arm out to the side and do a similar maneuver with tucking in the arm and the hand. So now we have a lower extremity, including a high gluteal drape for the purpose of treatment.